Actually, there is a one or two line they also mention like you need to pause in between to wait for the cues.
No,
That is also mentioned.
what they mentioned, like you go slowly and uh, take little bit pauses so that examiner will give you the cues at appropriate times where you expect the
Yes.
cues. The examiner
Yes.
take some pause, but don't ask the examiner again what is the speech, what is that mentality. Examiner will speak only when he feels that he needs to give the cue. Then otherwise you take that examination normal,
Mm-hmm.
this way.
Okay. So the same case, child on the wheelchair. Okay.
Okay.
Uh, girl name is Jenica, 10-year-old girl who has difficulty in walking. Your task is to do lower limb neurological examination. Okay.
Okay.
Uh, in the queue, mm, the wheelchair picture is there. Once you are ready, you tell me.
Okay, I'll start.
Okay.
So
Start.
I'll introduce. Hello, I'm Dr. Sandeep, one of the candidate here. I'll gel my hands. I will take the permission from the mother for the examination. Mom, can I examine your child? And then I'll take the
Yes, you can.
permission from the child also. Hello, Jenica, how are you? And assess her mentality and speech. Then I'll ask mom. Ichi, so I will have the first look. Is there any instrument or is there any medicine or any? I'll assess the nutrition and build of the child in the first look. Also, I will look for the any syndromic features in the child, uh, any facial
The
dysmorphism.
uh,
Uh,
build is normal, no syndromic feature.
okay. Okay, then I'll ask for the adequate exposure of the child. Mom, can you help me that can I so that I'll examine the lower limbs of the child. Then I like ask the examiner whether you would like to examine me the child on the wheelchair or on the couch.
Okay. Yeah, you can do both
Okay.
as you like. Yes.
Then I'll confirm whether the child is able to walk or no. Mom, can the Jenica walk?
Yes, she can walk.
Okay. So with support or without support, I'll confirm that. So then I'll
Yeah.
ask the child to walk slowly and observe the gait. I'll ask the child to
Okay.
go and come back to me. If she is
Okay.
able to do
So
it properly, then
she can walk with the support.
okay,
Without support, she might fall down.
okay, okay. So uh, what kind of gait I'm expecting here?
Yeah, she has a wide-based gait,
Okay,
wide-based ataxic gait.
okay. Uh, Ataxic gait. Okay. Then I'll take the child to the I'll take the child to couch and uh, observe the lower limbs. I'll look for the symmetry of the limbs, any atrophy, any skin color change, or any abnormal movement, fasciculation, or any scars, any contractures, any deformity in the foot.
There
Uh,
is no deformity, no scar, no contractures.
Okay, then I would like to examine the tone of the child first. I'd like to examine the posture of the child, whether it is hypotonic posture or any contracture type of posture. Then
No contracture posture. Looks like a child is sleeping normally in the couch.
okay, then I would like to feel the muscles of the thigh and leg and do passive movements to check the tone. Uh, Then after that, I would like to check the power in the at the hip
Tone
joint.
is reduced. Tone is
Then
reduced.
okay, then I would like to examine the power at the hip joint by asking the child to draw the limb towards her. I will check for the flexor, extensor, and abductors group of muscles. After that, I would like to examine the power in at the knee joint. Either I'll examine the power in the quadriceps muscles and the hamstrings by asking the child to flex the limb and extend the limb. Then I would like to check the power in the at the ankle joint by asking doing the dorsiflexion and plantar flexion. Oh, after
Okay, so the power also you feel it is reduced. It is 3 by 5 uh, and 4 by 5.
okay,
3 by 5, yes.
I will
Uh,
do the same thing on the both the sides and compare where there is
hmm.
any asymmetry in the power. Then I will go
There
for
is no
the
asymmetry. Both sides you feel it is reduced.
okay. Then I would like to go for the reflexes. I will find the patellar tendon and check for the knee reflex bilaterally. After that, I will find the tendon Achilles and I'll tap with the hammer to see the ankle jerk. Then, with a firm object, after explaining the child that I will scratch your foot from the lateral side, I will scratch the foot from the lateral side and to bring the firm object towards the base of the thumb and observe for the whether it is flexor or extensor plantar.
So you feel it is decreased, reduced reflexes, knee, ankle, as well as the plantar. Babinski, you could not elicit.
Okay. Then after that, I would like to do the back examination to observe for any scars, kyphosis, scoliosis.
Okay, so time's up. 6 minutes is up.
Okay.
Now you have remaining 3 minutes. Okay, so continue. What you else would like to?
After finishing the back and lower limb examination, I would like to do motor examination of the upper limb. Uh, like I will first check for the uh, observation for the any asymmetry, any
So
wasting of
now
the
you are
muscle.
presenting your case. Now you
Okay,
are
okay,
presenting
sorry,
your
sorry.
case. Okay.
Today I have examined Janika, who is averagely built. I would like to plot her an appropriate growth chart. On her, she is in wheelchair. However, she can walk with support with a wide base ataxic gait. Uh, on our motor examination, the tone in the lower limb is reduced. She has grade 4 power at the hip joint and grade 3 power at the knee joint. Her reflexes are reduced bilaterally, uh, and her Babinski sign cannot be elicited. Putting all these things together, uh, she's probably having a lower motor neuron type of lesion.
So what is most likely? What do you think is this case could be?
This case could be a case of limb girdle muscular dystrophy, uh, or could be a myotonic dystrophy or any metabolic myopathy, or
Okay.
considering GERD, it could be dermatomyositis.
Okay. Okay. So fine. Still, there is a 1 minute is remaining. What else you would like to rule out?
So I would like to do the neurological examination and do the cranial nerve examination as well. Also sensory examination and cerebellar science syllabus.
Hmm. So I gave you one cue, wide base ataxic gait. Did you
Mm,
hear that or not? Wide base
yeah, yeah,
ataxic gait.
I heard that.
Were my words clear or you did
Yeah,
not?
it was clear, but
Okay.
Romberg sign.
Uh, yeah, you did not ask for the, let's say,
Actually,
I will tell you good thing and bad thing both. Yeah, yeah, tell me, continue, then I will
actually,
tell you.
if there is already ataxia is there, you are not supposed to do Romberg sign. If there is
Hmm.
if there already ataxia is there, then there is no point in doing Romberg sign. That's why I skipped actually.
Okay. Tandem walking, did you ask?
Tandem walking I could have done. See, it is very easy to read and remember, but eliciting and verbalizing is too difficult.
Now you got the point. Yes,
Right.
true. This is what is.
I guess my examination was one of the worst amongst three.
No, in fact, to be frank, your verbalization was very good. You were very succinct in your, you know, in a rhythmic way you proceed. That was very nice. That's what I feel. And the missing part was the other component. For example, um, tandem walking, heel to sheen test, dysdiadochokinesia, or I mean, you did not probably think of the cerebellar kind of lesion, so which
See,
is okay.
if this has been an actual if this has been actual exam, na, I would have done it for sure. But during verbalization, you just forget the things in the
Yes,
fit of completing the exam. I have to do motor.
actually.
So that is in my mind. I just cerebellar just went out of mind. But if it had been an actual exam, I would have done it.
Hmm.
So
Right.
that's
So
why I
it is.
think they
This is
have kept the pass marks very low.
the confusion, like what whether to what is they they give a big webinar, but and they the example also they give very simple, like I'm going to tap on the patellar this by with a tendon hammer, but they did not say like how I will instruct for the power. They said yes, you have to check power for all the group. They said they also mentioned like you have to look for the bridge sound and all, but see this is like other station, and the this neurology is slightly difficult while executing the instruction, right?
Yes, I think
Like for example, I will tell you, you said power, you said like what is power in while giving instruction for the power. You said you will ask to bend the thigh, and then for the tone also you said yes, I will just do the passive movement of the leg, but you did not mention at the level of ankle. You will check the both ankle tone. You did not mention like tone at the level of knee. You just say passive movement of the leg.
see
And the
like
same way with
even after doing it so fast, the 6 minutes were not sufficient. I could not reach the cerebellar science.
exactly, you were the fastest amongst all of three. What we did presentation, you were the fastest.
Still, I could not manage. Then how we are
Still,
supposed to do it in the exam?
for example,
Exam
when
will
Dr.
be of
Hiba was
more
mentioning,
stress.
yes, when Dr. Hiba was mentioning about this thing for when she was checking the power for the finger, it was like I was not getting appropriate understanding of what she's checking. I knew because we know that she is checking for the finger abduction and adduction.
So, what I think. So
What is
what
the
I think
inference?
you would do. Hello, Hiren.
Yes, yes,
So we'll take the task like let's make a template for lower limb examination with the instruction and upper limb
yes.
examination for the I'll take the task of making for lower limb. Any of you take for the upper limb examination.
Okay. Yeah, that is better.
And one will do cerebellar examination template, and one will be you do the neural this cranial nerve examination template. Let's take 4 templates, and let's
Yeah.
discuss in the next time meeting. How does this sound?
Yeah. This is nice actually. And then we'll try out that template whether it
Yeah,
works within the time limit or not.
like with the instruction, whatever we feel like after reading the RCPC instruction, let's go through the instruction and make a template, and we'll discuss it next time quickly. Okay.
Yeah. Yeah. Yeah, that
So
is right. So you were talking about